So I'm going to start this directed learning just looking at the chapter and then kind of going back and forth to the objectives and the lesson builder. So I think I'm going to start with the lesson builder. So the objectives of this week is looking at healthcare financing and getting you better educated on the various payer systems and a better understanding of how physical therapy is paid. That is the overall objective for this week. I've intentionally made this the last week of the term, or at least the subject, because it's not the most exciting subject of your learning as emerging professionals, but it's probably one of the more important chapters or lessons for the term, truly because it is what keeps our doors open and what allows us to practice if we're not getting reimbursed by our services, whether it be a government payer source, private insurance, or by another third-party payer, including just cash. We're not going to be able to operate in any way in terms of the business model, and your business just will not succeed unless you're purely doing pro bono service, which is very altruistic and great, and certainly in some cases that is what we do. So the objectives are, to really look at what's being called out here is defining, what is Medicaid and what is Medicare, and really understanding, what is durable medical equipment. DME is durable medical equipment. Is covered on page 128 in the textbook in chapter 6, and specifically what we're looking at in durable medical equipment is, how do people get the equipment that are needed, right? Reusable equipment, and defining what DME means. Patients at times need orthotics, braces, assisted devices, other equipment to get better, and it's our role to help them locate where these items are and to give them some basic understanding of how they're paid. So in the workers' compensation system, I think that is one thing we actually do pretty well in the state of Oregon. It's offered under the product called SAFE, which you'll learn a little bit about. And you'll learn a little bit about the Oregon Health Plan, which is part of Medicaid funding, and then about some of the other ways healthcare is paid, including the Affordable Care Act and how that's changed our ability to treat patients in many cases for the better. But we're just going to go over that briefly, and then really kind of look at how Medicare's reimburses for PTAs in various settings. Medicare is the largest payer source that is out there for most of where we're going to work as PTAs. As you have learned in this term, that more of our graduates, at least, and the overall trend is, and it's tend to work with older adults that are eligible for Medicare, so that is our primary payer source. So that's why we're looking at how Medicare reimburses in various settings. It also tends to be the gold standard, not gold standard, but really the it is the bar that other insurances look at in terms of how they reimburse our services for physical therapy, and how PTs and PTAs are reimbursed based on the various settings currently, which is great. The services provided by PTA are reimbursed the same level or the same amount as physical therapists. There's been some challenges to try to reimburse services and PTAs less. We talked about that earlier this term a bit, those who have met with me before the term, and have raised that issue, but thankfully that that idea has been shelved, meaning that there is no plan to enact that for outpatient services, that pay differential for PTAs and OTAs versus those with advanced degrees, physical therapists and occupational therapists, which is really good news. And then really looking at how where healthcare dollars go, and I think that's very rich to know that information. This is based on 2014, 2015, 2016 numbers, which really wasn't that long ago. Really want to call out what's due this week. You have a graded quiz And then you have a group assignment that we'll talk more about in another directive learning, and that is what's coming up this week. So as you go through how physical therapy is paid, just know that I'm just giving you kind of the big picture bullet points or short narratives, and that's really what I want you to know. These supplemental learning materials, such as websites, are pretty rich with information, but can be a bit daunting if you aren't a biller or have experiences running your own business. So there's been no expectations that you would know information that is on these web links unless they're specifically called out in the short narrative that is provided here. So I'm going to step out for now, and we'll come back to just define some key terms for you in another short narrative.